Hello friends, Namaskar. So 3 months have gone, lots of water has flown under the bridge. I had requested you during the introductory talk of first week that we'll see you after 3 months. This is week 12, 3 months have passed and we are generally at the end of our course, that is Certificate in Integrity Palliative Care. This particular week pertains to first aid.
What is first aid? When you provide a basic medical care to someone experiencing a sudden injury or illness, it is known as first aid. And the term first aid first appeared in 1878. In some cases, the first aid consists of initial support provided to someone in the middle of a medical emergency. And this support might help them survive until professional help arrives. So here you are not an expert, you are just providing some support, some aid till the expert aid arrives. So in other cases, first aid consists of the care provided to someone with a minor injury. And for example, first aid is often all that's needed to treat minor burns, cuts and insect bite.
So in a way we can say that second type is basically that is what we provide at home.
Yes.
When something such minor injury takes place to the children or somebody else. What are the priorities of first aid? There are basically 3 priorities. Why do we carry out first aid? First is we want to preserve life. We want to stop the casualty from dying, and therefore we want to keep everyone alive. Basic ABC, airway, breathing and circulation, these are the 3 basic things we do so that that injured person does not die. Preserve life. Second, prevent further worsening of the situation. Stop the casualty from getting any worse by treating their injuries. And last, third one is the promote recovery. Try to help the person feel better by talking to them and supporting them emotionally.
So in these 12 weeks, we are going to teach you about, firstly, the first lecture is on introduction of the first aid. Second is on purpose of first aid training. Then we will be learning emergency procedures in first aid. Then outline of CPR, that is cardiopulmonary resuscitation. Let me tell you, this is not a formal training in CPR. This is just an introductory or informative talk. Then you will learn about making a splint. Then you will learn how to give recovery position and what to do in emergency scene management.
First aid. These are the things that this is the first lesson, first aid.
Yes.
Second is
On
purpose of first aid training. Why do we want this? What is the purpose of first aid training?
That is
those three things basically
preserve life
and
improve recovery
and one more. Okay, should I show it to you? This is the purpose of training. Preserve life, prevent further worsening the situation of the injured person and promote recovery. Then understanding first aid training. The ability to provide immediate assistance to the injured or ill is a valuable life skill. And first aid training helps individuals acquire the necessary knowledge and skills to be effective in doing so. Such training empowers individuals to respond quickly and appropriately in emergencies, stabilizing the condition of the person in need and prioritizing the care. First aid treatment saves life and minimizes the severity of injuries or illnesses, enabling individuals to respond to accidents, heart attacks, choking burns, bleeding and other emergencies with confidence and competence.
This is the headquarters in New Delhi of Indian Red Cross Society.
Indian Red Cross Society is the major organization which carries out first aid training all over India. First aid emergency responses. Yeah, can you tell us
Emergency
something?
procedures. So, first aid and emergency procedure provide a framework on how to approach a potentially dangerous or risky situation and or when someone is hurt. And this will help you stay calm. That is a first requirement of when you are enter into the scene of emergency. First requirement is to stay calm, make safe choices, make yourself safe as well as the victim safe, and reduce the time it takes to help to arrive. And some emergency procedures are routine like cuts, grazes, and blisters and minor burns, and this you may treat at home as well. You are not expected to be an expert first aider. It will help you identify a possible illness or injury and act in a way that
That
helps
helps
a
a casualty.
casualty.
CPR, this is your
This
subject.
is very important, and nowadays many organizations want their staff to undergo CPR training, particularly police department and some factory workers also needs to know about the CPR because such emergency or catastrophe can occur anywhere anytime. So, what is CPR? It is a cardiopulmonary resuscitation. It aims to keep the blood and oxygen flow through the body when a person's heart and breathing have stopped. And CPR is for people experiencing cardiac arrest. So, when the victim is unconscious, unresponsive, and not breathing, you can start giving CPR immediately. A heart attack occurs when blood flow to the heart is blocked, but the person is still conscious and not yet in cardiac arrest. Someone experiencing a heart attack may go into cardiac arrest and should go to the hospital immediately.
Splint.
Making a splint, very easy thing, but very if it is done precisely, you can reduce pain on the site of injury, you can reduce swelling, and you can comfortably ship the victim to the nearby hospital.
Okay. A splint is a piece of medical equipment used to keep an injured body part from moving and to protect it from any further damage. If my hand is broken, these two bones, which are those bones?
Radius ulna.
Radius and ulna, if they are broken, doctor has done something, they have been joined, but then we'll put a splint here, top, bottom, bandage it so that those joint bones do not move. They remain in that particular joint position maybe for a month or 2 months as per the medical advice. So that is called a splint.
It can also be used if you have a severe strain or sprain in one of your limbs. If the splint is placed properly, a rigid splint will help ease the pain of an injury by making sure that the wounded area doesn't move. If you or a loved one is injured at home during an activity such as hiking, you can create a temporary splint from materials around you. And that material could be a rolled towel, rolled newspaper, or a piece of wood and plank.
Recovery position. The recovery position has been a staple of first aid for decades. It is the specific positioning of an unconscious or unresponsive person to keep their airway open. Airway is from where? From nose down to the lung. Lower their chance of aspiration. What is aspiration?
Means any vomitus or any secretion in the mouth, if it enters into the windpipe, it is called aspiration.
Okay. Reduce chest pressure, limit neck movement. Originally, the recovery position was left side only. People thought this would decrease the chance of vomiting. Over the years, however, either side has become acceptable. The exception to this rule is pregnant people. People must place them on their left side when possible to maintain proper blood flow to the baby.
Lastly, you will learn about the emergency scene management. So, emergency scene management is a vital skill for all first aider and first responders. So that this emergency can be accident or a injury or a natural calamity, tsunami, flood, earthquake or anything. The safety rescuer is the first priority in any emergency situation. So care in approaching the scene is critical. So first and foremost is keep calm, then make the things safe for yourself as well as for the victims. So be alert to the hazards which are obvious like fire, smoke, fallen power line, hazards which are hidden like a needle under a casualty, hazards which may develop like a change in weather, movement of a vehicle or a structure, a fire which is out of control.
It is important to confirm that emergency services have been notified.
Yeah, that is the second
Yeah,
step.
second
That
step.
somebody has to notify the emergency
So they
services.
come on the scene and carry out
Yes.
rescue as possible. Thanks ABC to CAB. What is ABC to CAB?
So previously it was part of CPR was ABC, airway, breathing and compression. Now since 2010, American Heart Association has changed over to CAB. They said that compression of the heart is more important because it has got still some amount of oxygen inside which can be given out to the body parts. So start compression first, then clear the airway and then start breathing.
I can say thanks. We are now from A to Z. A was our first week. We traveled so much, and Z is our 24th week. And I am happy, Dr. Geeta Joshi, we are together here, and I am certain all those 3, 4, 5,000 students or the people who have gone through our course, certificate course in integrative palliative care, they must have found our course interesting. Aim was to tell you something. Aim was not to teach you. This is not a hands-on training. I can say aim was to give you fast food, not exactly those fast food which in our nutrition, diet and nutrition we say don't eat it. You should not eat it. Fast food means what we can give you fast in just 24 weeks. That is
just
fast
just
food.
crunch of the subject.
Crunch of the subject.
Just
Yeah.
elements of the subject you will learn, and I am these results of last many courses we have run so far in last 3 years are very encouraging, and I am sure even this course you will find it interesting. This complementary medicine or complementary therapies you can practice on yourself first, so that will increase your overall well-being and your health will improve. Is it right?
Yeah, 100%. Actually, that's what I have been saying every time. This course is basically for you. If you learn something about it, read further, understand it, practice it on yourself. I'm telling you, my dear friends, that you will be in such a state of those preventive measures that the sickness will never come nearer to you. And if at all it comes to you, nearer to you, your vitality will be so much that you'll be able to kick it away. This is what was the intention of running this particular course. So we just say thanks to them.
Yes, thanks everyone.
Thanks
and
everyone.
All the best
Yeah.
for your exams and for all assignment. Keep it make it sure that you do your assignments in time. Thank you very much.
Thank you.